Hi, it's Dr. William. I want to talk to you today about the bottoming out of an implant, what that is, why it happens, and how to fix it. So here's a fairly typical example of somebody that has implants that have bottomed out. And by that we mean that the implant has descended. Okay, the implant has come down and it's not in the correct position anymore. And the way you can tell is you can see that the nipple areolar complex here is very high on the breast. And this distance that's here from the nipple all the way down to the fold here is long. So this distance here is very long from the inframammary crease up to the nipple areolar complex. We want the implant, if you look at an implant and you just take an implant here and then you imagine that implant underneath the breast, we want that implant to be centered underneath the nipple. And so you have your breast and then that's centered right underneath the nipple. Here, if you look at an implant that's bottomed out, the nipple areolar complex should be probably in this location. That's a more central location. And that way the implant is centered right underneath that nipple areolar complex. When the implant drops, it moves the nipple up. It gives that appearance because you've stretched out this bottom skin. And it typically happens because this fold that's here in this area is not secured properly. And so when I do what we call a primary breast augmentation, which is the first time someone's had a breast augmentation, then what I do is I will, let's say here's the breast here, and there's the areolar complex, and then the implant is getting placed in here. We want the implant centered underneath the breast so you can have that nice projection. But then what I do is in this area here, which is along this area here, I will place some stitches, and they're permanent stitches, and they will secure that fold so that the implant here's the implant here, so the implant is not able to go anywhere because I've got it anchored here. And so that's secured. So the implant will always stay centered underneath the nipple and the areola. Everything may droop a little bit with time. We can't stop gravity, but at least you're not in a situation where the implant is dropping faster than your breast and you get this very peculiar look to your breast. So that's why it happens. How do you fix it? So basically, in order to fix this, what we have to do is we have to go and we have to redo the fold. We have to put the fold into the correct position. The real place where this fold should be in her would be if I were to pull down on the skin and move the implant up, then that real fold is probably somewhere in this area. And so we need to put internal stitches in here to recreate that fold. Now, if somebody doesn't have super strong tissue and that's contributed to the way that they're bottoming out, then what we do is we'll actually place a material that goes right in here. I use Stratus, but sometimes you can use Galaflex as well. Any type of mesh, but usually in this case I use Stratus because I feel it's a little bit stronger. And so what I do is I will take that mesh and make a little hammock in this area, and that will allow me to recreate that strong support. And then I sew this down. I put stitches, I put sutures in, and actually put them right into the top material. It's called a periosteum that's on top of the rib. And the reason we use that is because that is really hard tissue. It's like solid. So it's a strong, strong anchor. And that will re-secure the fold and that actually re-establish the fold. And then with those strong sutures to the periosteum, it'll keep that in its place. And then we'll sew the other part usually to the muscle. This upper part here, we can sew that to the muscle. And that way we create a new location for the implant, and the implant will be in a higher position, and it'll be in a better position, and it'll be centered underneath the nipple areolar complex, so we don't have this long part and then this, because the other problem you get when you get a bottomed out implant and you get this long distance here, then you also get a emptiness up here in this part. When you look at the side here, the two things that we're talking about here is, number one, in this area here, that's that hollowness, okay? That's hollow up there. Obviously, we don't want it hollow in that area. We want that area to be nice and full. And then because this distance here is very long, it causes that nipple to start to look in this upward direction, giving it that what we call a stargazer nipple. It's a very unusual appearance. And so this length here, this hollowness here, and the upward position of the nipple, all of those get corrected when we reposition the implant in a higher location and get the implant in the correct spot. Most of the time, patients are having breast augmentation to get a larger size, to get more fullness to their breast, to get better cleavage, but also to get this area here in the upper part. So if you don't secure the fold to begin with, that implant will just drop, and then you're going to be empty in the top part, which is exactly the opposite of what the whole plan was at the very beginning. So that's why you bottom out, and that's how to fix it. It takes a little bit of experience, I would say, to restore the implant and to fix that problem. But the best way to do things is to prevent it at the very beginning by putting those initial sutures.